Here, Dr. Soltani prepares the otoacoustic emissions test. Otoacoustic emissions are sounds generated by the inner ear which can be measured by our testing equipment, either spontaneously or as an evoked response to specific stimulus. The test is used for both children and adults as a measure of inner ear health, and it is typically performed by an audiologist. The VEMP test uses a sound stimulus, but is actually a test of vestibular and balance function. Specifically, it is used to give a measure of the performance of the saccule and the inferior vestibular nerve. Prolonged or absent VEMPs can be an indication of specific balance problems. The test is typically performed by an audiologist. The VNG is the new standard in balance testing. It uses infrared goggles to measure eye movements in response to different stimuli, providing information on the vestibular-ocular reflex. A common use of VNG is demonstrated here, where the ears are irrigated with water, causing dizziness, which is measured through eye movement. The test is typically performed by an audiologist. A routine audiometric evaluation typically consists of pure tone audiometry and speech audiometry. Air and bone conduction pure tone audiometry are used to assist in determining the degree, type and configuration of a hearing loss. Speech audiometry allows the clinician to assess the client's ability to comprehend speech in both quiet and in noise, and also provides information on how quiet speech can be understood. Both pure tone and speech audiometry are behavioral tests that can be performed on adults and children who are old enough to cooperate with the test procedure. Audiometry is typically performed by an audiologist, a hearing instrument practitioner, or a technician. Tympanometry is used to test the condition of the middle ear, which is the space behind the eardrum, by applying varying air pressures to objectively measure energy transmission through the middle ear. Acoustic reflex testing is typically performed in conjunction with tympanometry, using the same equipment. The acoustic reflex is an involuntary muscle contraction that occurs in the middle ear in response to loud sounds. The presence or absence of the acoustic reflex provides helpful diagnostic information. Tympanometry and acoustic reflex testing are typically performed by an audiologist, a hearing instrument practitioner, or a technician. Ear mold impressions are taken for the custom production of in-the-ear hearing aids and of certain behind-the-ear hearing aids. They are also used in the production of custom hearing protection, swim plugs, and musician monitors. The ear mold impression is typically performed by an audiologist, a hearing instrument practitioner, or a technician. Hearing instrument fitting and programming involves several steps. First, an individual will undergo a thorough review and discussion of their hearing loss as well as a needs assessment in order to determine the most appropriate type of technology for their listening needs. Hearing instrument fitting is part of a broader treatment spectrum called oral rehabilitation, which will involve counselling and education. If a hearing aid is recommended, the next step begins with a trial period. The fitting session involves programming the hearing aid to match the individual's hearing loss and verification of these settings. Orientation is done and instructions are provided. Follow-up and adjustment are typically done 1 to 2 weeks post-fitting and may continue until both the client and clinician are satisfied with the outcome. A review of the needs assessment is then done to evaluate hearing improvement. Hearing instrument fitting and programming is performed by an audiologist or hearing instrument practitioner.